Hello, ladies. I hope you can hear me. I hope you're all safe and dry. I am so waterlogged and so over it, it's getting beyond boring. But you're not here to listen to me talk about weather. So today's conversation is one I think so many women need to hear because there are a lot of women walking around feeling exhausted, foggy, cold when everyone else feels fine, struggling with weight despite doing everything right, fat, flat, puffy, losing hair, dry skin, and not feeling like themselves while being told it's all just menopause. And sometimes it is menopause, but sometimes there's another layer to it, another layer underneath it as well, adding to that or exacerbating it. So how many women have been told, whether you're here live or watching the replay, how many of you have been told your thyroid is normal, your blood tests are fine, it's just your age, it's just hormones, it's just midlife? Excuse me, thyroid makes hormones, so we should be looking at it more. Meanwhile, you can barely get through the day. This is where menopause and thyroid dysfunction become incredibly confusing because they wear almost the exact same costume, so they can look the same unless you know how to look underneath, right? Menopause and thyroid dysfunction overlap so heavily that women often are dismissed or very much under investigated. And one of the biggest myths is if it's menopause, it can't be thyroid. That simply is not true. Many, many, many women have both. I often explain it like this. Menopause and thyroid dysfunction are like two women wearing the same outfit at a party. From a distance, they look almost identical. Fatigue, weight gain, brain fog, mood changes, hair changes, sleep issues, anxiety, sweating, palpitations. Not much fun at a party, is it? These symptoms overlap so much that women often get stuck in diagnostic limbo. Could be this, could be that. Maybe we'll try this, maybe we'll try that. So let me talk about a lady I worked with who actually typifies a scenario I see a lot. Both back in the day in my medical imaging and then in clinic now. Right. Tracy, she was in her early 50s. She noticed that she was exhausted all the time. Hello. I think I've got about 5 messages today about fatigue being the biggest one, the biggest problem a lot of you are struggling with. She's gaining weight around the middle. That would be the second most common. She feels cold when everyone else feels fine, but then gets hit with a bit of a power surge. Her hair is thinning. Her skin feels dry. She can't think clearly. Her motivation has disappeared. She went to her GP, told them her symptoms and the fact that she was concerned about her thyroid, as there is some family history of low thyroid function. The GP tested her TSH, which is her thyroid stimulating hormone, and said, oh, it's within range, and told, welcome to menopause. So she accepts it, but deep down, something felt off. So she came to see me, and initially I said, well, your TSH is not in disease level, it's not the red zone, but it's not in optimal range either. And we call this subclinical hypothyroid. The TSH is high, but not over that threshold, not over the level for a diagnosis of disease. But when you put that with the symptom picture, the time frame, the family history, voila. So we did some functional testing, and sure enough, the other markers told a different story. So whilst I was waiting for those tests to be done and the results to come through, I started treating her for hypothyroidism anyway. I made some dietary changes. I looked at supporting her hormones and, of course, her liver, as your liver converts hormones from inactive to active. And if that's not functioning properly, if it's not metabolizing your hormones, it's not going to happen, even if your thyroid is producing it. So there's a few different steps along the path with thyroid hormones, but let me get back to Tracy. So I'm not going to say it was a miracle cure, but I will say that within 6 weeks, her symptoms had reduced dramatically. And at 12 weeks, her markers were within normal range again. Now, I know a lot of people sit and wait to see if it tips over to that, over the edge first to go into that red zone. But even if when it does, the medical answer is thyroxine. And that, which is T4, right? And that may bring your TSH into range, but may not help your symptoms. So on paper, once again, your numbers are fine, but that doesn't mean you're going to feel fine. And that's the other common scenario I see. Many women I have worked with are already on thyroxine and find that when they hit menopause or perimenopause, they are needing higher and higher doses just to function, and or at least maintain happy TSH levels, bringing it back into acceptable. And yet they're still struggling. The fatigue being the biggest one that I hear a lot of. So ladies, what is your thyroid, right? The thyroid is often called the body's metabolic thermostat. It's a little butterfly-shaped gland here in your throat. It influences, or in your neck, not in your throat, your throat. Influences your energy, your metabolism, temperature regulation, digestion, mood, hair, skin, cholesterol, heart rate, brain function. So when your thyroid function slows down, you can imagine everything else starts to slow down too. Everything becomes sluggish. So your body doesn't raise the temperature quick enough. When you eat, it's slower at being digested, slower elimination. So we often get constipation with it as well. And I spent nearly 20 years in nuclear medicine, trained to find what others miss. And what I see missed most in midlife women is this conversation. Why is it that it makes it worse? Why does it suddenly escalate in midlife? And that's because menopause changes the picture. For years, estrogen, progesterone buffered a lot. And as these hormones decline, well, as we know, estrogen does its roller coaster all over the shop, and progesterone just quietly exits the back door. So as those hormones decline, women tolerate stress less well. Metabolic flexibility changes, inflammation rises, recovery worsens, and thyroid dysfunction often becomes much more noticeable. Not necessarily because menopause caused it, it's because the hormonal shifts amplify it. As I say, life creates the cracks, menopause shines the torch through those cracks, making it more obvious. And the big misconception, honestly, one of the biggest is if my TSH is normal, my thyroid must be fine. Now, TSH itself, right, is an important marker, yeah, but it's not always the whole story. TSH actually stands for thyroid stimulating hormone. And so what it is, it's your brain signals to your thyroid, right? So it's signaling to produce thyroid hormones. So as I said before, there's a couple of stages. So your hypothalamus and your pituitary might say, oh, we need more thyroid hormone. It's TSH, sends the message to the thyroid. That's what we're measuring. What's the messenger saying? Now, that's not checking what the thyroid's doing with that message. TSH is not showing us if your thyroid is actually producing enough of the T4. It produces other hormones as well, but I don't want to get too complex. So we haven't checked what your T4 is. And that's another part, because then that has to go to the liver, and the liver converts that to T3. Amongst, there's active and inactive, and there's reverse T3. So as I said, I don't want to get too complex, but TSH, I just want to make it clear, is testing the message to the thyroid, not what the thyroid is doing and not what the liver is doing with the hormones the thyroid has produced. And so you can have a normal TSH, or the TSH can be in range, as I said, but it's not going to tell you the whole story. And so women, you can still have symptoms. You can still have poor conversion. You can still have autoimmune activity, such as majority of the time it is Hashimoto's, hypothyroidism. The autoimmune condition is Hashimoto's. Overactive thyroid is Graves' disease. And so that's, imagine, one is the foot on the accelerator, and that's that sort of anxious, fidgety person, loses weight, although, everything's running on high and overdrive. Hypo, everything's low, okay, and low, slow, and sluggish. All right, so you can be struggling with all those. You can be struggling with the symptoms, the poor conversion, the autoimmune activity, the metabolic dysfunction, while being told everything looks normal. So you need to ask your GP about free T3, T4, thyroid antibodies. Those are the markers that give us the fuller picture. Now, unfortunately, GPs have to work within the Medicare guidelines, and that's why a lot of them will not just say, yes, of course I'll test those. Right, so that's what I'm saying. You have to look at the picture, the whole picture. And we also need to, as I say, about that Hashimoto's, which is one of the most common causes of hypothyroidism in women. This is where, so autoimmune, the immune system attacks the thyroid, and women can feel unwell for years before diagnosis, because the antibodies aren't being tested. Again, fatigue, brain fog, weight changes, anxiety, hair loss, all overlap heavily with menopause. And that metabolic connection, it's really, really important. This is why thyroid is not just a thyroid issue, and why I have been covering this step by step by step for all of you ladies in this symptom decoder series that I've been going through, because low thyroid function can worsen your cholesterol, your blood pressure, your weight, your constipation, your insulin resistance, your mood, your fatigue. It amplifies the whole metabolic picture, which is why it fits so strongly into everything we've been talking about in the series. So, ladies, I think one of the hardest things for women is feeling like they have to fight to prove they don't feel well, especially when they're told your tests are normal. Because women know when things feel off in their body. And I always say, symptoms speak louder than numbers on a piece of paper. So if it's like someone slowly turning down the dimmer switch on your energy, little by little, not dramatic overnight collapse, not like you've got a virus and you wake up and you think, oh my God, what, I've been hit by a bus. Just less energy, less motivation, less temperature regulation, less resilience, less clarity, until one day women realize, I just don't feel like myself anymore. It's that slow domino thing. So what does help, what helps is not to panic and not to self-diagnose yourself from this talk or from TikTok. It's a proper assessment, looking at the whole picture, your symptoms, the patterns, the bloods, your metabolism, your stress, your inflammation, your hormones, your lifestyle, because thyroid rarely exists in isolation. So today, I want women to remember menopause and thyroid dysfunction overlap heavily. And say they've got the same costume on. Women can absolutely have both. Normal doesn't always explain symptoms. And women deserve to be properly listened to. And if you're listening today and quietly thinking, that sounds like me, please don't ignore that. You can comment under this video, thyroid, and that's me, whatever you like. You can send me a message privately, right? Or you can book in for your health conversation where we can talk one-to-one. What's going on? What do I think it might be? What would be your best first step? Where we can start looking at your picture properly, because this isn't about guessing. It's about understanding what your body is actually trying to tell you. You know your body better than anyone. And that's one of the key things I listen to in clinic. And it's one of the things that drove me from working in nuclear medicine to naturopathy, because when you work in a hospital system, whether it's nuclear medicine, I also did sonography, so ultrasound, you go by what's written down. But when you actually listen to the patient, and I say, well, how long have you been feeling like this? And what does your normal feel like? Are you usually a morning person? Are you usually, you get up and go at them? What is your normal? Because you can't compare your normal to the next person. You've got to do it for what's normal for that person. Okay. And so it's really, really important for you to note and say, well, I used to be able to do this. Now I'm struggling to do that, because you want to put that into context for your GP or your healthcare provider. Okay. So I don't want you ignoring something that could be helped, fixed, reduced, supported. Right. And if you want to go deeper on your metabolic picture, I'm running a challenge. Was going to be next week, but I'm going to put it off for a week because I did the workshop yesterday, and I want to just next week's going to be big about pulling all of this symptom decoder together next week, and then we'll run the challenge when it's all making sense in your head, and we're not just looking at all the pieces, not just looking at cholesterol here and liver health there and blood pressure there and so forth. I want to bring it all together so it makes sense, and then we'll do the challenge, the 5-day metabolic reset challenge the week after. Hope this has been helpful for all of you ladies that have got a thyroid condition. Even on my audit, it's one of my questions: do you suspect you have, or has it been confirmed? Because a lot of people suspect it, but it hasn't been confirmed. And I hear that. I listen to that bit too. All right, ladies, hope you stay well and dry. As I say, I'm about to float away, I think. All right, see you next week.